Imagine an operating room in a hospital with its cold light, that tense silence all around, and everything measured to the millimeter. It's a place where no one talks about faith. They talk about steady hands, technique, statistics, and if something goes well, that's science, and if something goes wrong, that's science too. For 25 years, Dr. Mario Alonso Puig lived there. Inside in an operating room as a digestive surgeon trained at Harvard and one of the best Spanish doctors. His job was, of course, to open, repair, and close. This involved arteries, organs, wounds, body, and more body. Everything revolved around the body until there started to be that there was something that didn't fit anywhere, Manuel. He encountered 2 patients, same age, same illness, same operation, same surgeon, and same operating room. On paper, they were identical cases, but in reality, they were 2 completely different worlds. On one side was him, a strong man with a good physique and a mind at war. He was a man filled with anger, at odds with the world, and holding resentment for what had been done to him. Something like a kind of script, of course, was running in his head. Everything is against me. And on the other side was her, an older woman with a fragile body and trembling hands. And a tired look, but with something very rare to find in a hospital: peace, and a simple faith. And with the feeling that she still had a mission in life, her internal dialogue was different. It was, I'm in good hands, I'm going to do my part. And whatever has to happen, will happen. After the operation, after applying truly flawless and meticulous technique in both surgical cases, that is to say, precise incision, careful suturing, prescribed medication, all performed in exactly the same manner, what doesn't appear in the books surprisingly manifested itself. He started to have complications. Infections came, relapses. It was as if he was taking steps backward, and every day was a struggle. His body seemed to respond to the script, the one he had in his head, that I'm alone, I'm against the world. She, on the other hand, was going against the current. Where the protocol said she would need 10 days to recover, it turned out she only needed 6. Where the report said, there's a high risk of complications here, her body seemed to say, that doesn't apply to me. And Mario looked at the lab results, the reports, the charts, and no matter how hard he searched for purely physical explanations, there was something there that just didn't add up. Until the phrase stuck with him, there's something here I'm not seeing. This person's mind is operating just as much as my scalpel did. And little by little, he gradually began to deeply suspect something truly huge and profoundly significant, that what actually happened in the patient's mind and psychological state after the complex surgical operation was just as critically important as the operation itself, indeed. That the mind, without having studied medicine, was practically behaving like the chief surgeon. And that profound suspicion truly changed his entire life. He immediately left the operating room, and not because the vital surgery itself didn't deeply matter, but because he intuitively sensed there was an even deeper, more significant surgery, the profound surgery of the human mind. And since then, his mission has been different. It has been to help you. To help you become the surgeon of your own mind, so that your biology finally has an ally. Mario couldn't just settle for this is faith. He comes from the world of statistics, of medicine, of science, not from the world of miracles. So what he did was what a surgeon does. When in doubt, he went back to science. And there he discovered a field that sounds like quite a formidable tongue twister, but is in reality quite straightforward and very, very simple: psychoneuroimmunology. Psycho, what you feel and what you think. Neuro, your brain and your nervous system. Immunology, your defenses, your inflammation, your ability to heal. The idea behind it is brutally simple. What happens in your mind doesn't stay in your mind. Your thoughts of fear, of threat, of I can't take it anymore, they're not just phrases. They are real electrical signals that your brain translates into chemistry, cortisol, adrenaline, and inflammation. And that chemistry, if it persists for too long, attacks exactly where our video series began, your telomeres. You already know that your telomeres are like the plastic tips on shoelaces, and when they wear out, the lace starts to fray. Well, when your telomeres get too short, that's the moment your cell says, this is as far as I go. And now add another variable, chronic stress. But not the stress of running late. I'm talking about years spent caring for someone who's ill, for example. The kind where you're at war with yourself or working in fear every single day. Science tells us that this sustained stress accelerates the shortening of telomeres. We've already seen that. And not only that, it also disrupts your immune system. What does that mean? A mind that is truly at war is also a body that is profoundly at war. And here, my friend, is the truly beautiful part. If your powerful mind can indeed make you sick, then that very same mind can also profoundly heal you. Compassion meditations, mindfulness practices, cultivating calm and connection, these aren't just trends. There are studies showing that long-term meditators have much more activity. Of that enzyme, we already talked about as well, telomerase, the one that repairs telomeres. Remember, we talked about it in the first video? In other words, you change your mind and your body responds all the way down to your DNA. And this is where, in addition, ancient traditions get interesting. Long before the word telomere even existed, there were already doctors who understood, who sensed this mind-body connection, and of course they did so in their own way. In classical Chinese medicine, for example, they didn't talk about telomerase, they didn't know about it, but they did talk about something just as profound, qi, that is the vital energy that flows through the body. For them, a sustained and misdirected emotion, it would block that energy and damage a specific organ. If it was chronic anger, it was associated with the liver. If there was uncontrolled joy or constant euphoria, that would exhaust the heart. If what existed was obsessive worry, it would harm the spleen and digestion. Or if you had sadness, a prolonged period of mourning, that would weaken the lungs. And if what you had was sustained fear, it would affect your kidneys. They didn't talk about cortisol, but they did see something clearly. When an emotion becomes stuck in your body, there is an organ that suffers. And when the emotion is released, the organ improves. Think about something very common, for example, a woman after a significant loss, such as a child or her partner, who feels as if she can't catch her breath for months, breathes shallowly, sighs constantly, and in the end her defenses go down and she ends up catching every flu and illness possible. A Chinese doctor, upon seeing her, would say, "The lungs are filled with sadness." The Western doctor would say, "The immune system is depressed due to grief. Cortisol levels are altered and inflammation has increased." Both are essentially conveying the very same thing, but in entirely different languages. Ayurveda, which is the traditional medicine of India, talks about ojas, It is the subtle essence of vitality, what gives you a sparkle in your eyes, mental clarity and resilience. While chronic stress, anger, the feeling that your life has no meaning, all of these consume it. All that essence, and this ultimately results in premature aging, what they call akalaya yara, aging before your time. If you carefully notice, they are indeed describing exactly the very same fundamental biological processes that we meticulously measure today in modern scientific laboratories: chronic oxidation, systemic inflammation, the progressive shortening of cellular telomeres, and the gradual wear and tear of the entire immune system. For Mario Alonso Puig, psychoneuroimmunology is the scientific language of a very ancient intuition. What you feel organizes what your body does, and exactly the other way around. What you do with your body can also change what you feel. And that's where the tool comes in that connects William James, whom we saw in the previous video, with Chinese Medicine and Ayurveda, with you. And it brings us to the practical part, that is the one you can use tomorrow morning or even today. When you're afraid, your brain goes into lion mode. Lion. Alarms go off, your cortisol rises, and your immune system becomes tense. Your mind says, this is dangerous, don't move, don't change anything. And Mario's proposal, which is inspired by the pragmatic philosophy of William James, is almost, one might say, insultingly and deceptively simple. Act as if. No, not as if you weren't afraid, because that would be a lie. It's clear that you are. Act as if your next action could be a little bigger than your fear. You have a difficult call. Your body is at war. The inner voice. That one tells you don't do it because you're going to mess it up. And the mental surgery here in this case is very specific. First, you acknowledge the fear and say, yes, I'm afraid. I feel it in my chest. It's true. Second, you change your internal dialogue with yourself and say, even with fear, I can take a small step. And third, you take the smallest possible action. Dial the number, prepare a phrase, press send. Then your body receives a very clear signal. If we are moving toward the danger, it's more than likely that maybe it's not so dangerous after all. And then something subtle but real happens. The alarm decreases, cortisol adjusts, the amygdala calms down, and your biology responds to your movement, not just your emotion. Think of a more everyday example. Someone who has been in a situation of social anxiety for months. Every time they receive an invitation, their inner dialogue tells them they're going to notice that I don't fit in and I'd better make up an excuse and not go. Every time I don't go, it's a biological message of danger, kind of like saying, out there, the environment is hostile, and in here is where I'm safe. Well, now imagine that one day this person decides to try a different approach. I really don't feel like going, but even if I only stay for 20 minutes, I'm going to go. There's no need to shine. I'm just going to go and be there for 20 minutes. The anxiety hasn't gone away, but your actions tell your body something different. And if you repeat this 10 times, your body gets 10 new pieces of evidence that the world isn't as deadly as it seemed. That's mental surgery. That's applied PNI, which, when carefully spelled out so you can easily remember it, is indeed Psychoneuroimmunology, a fascinating and complex field of study. The scientific discipline that studies the intricate and profound bidirectional connection between the human mind, the complex nervous system, the vital endocrine system, and the robust immune system, exploring their dynamic interplay. That's Chinese medicine in its 21st century version. Instead of simply moving the needle, you fundamentally change your overall behavior. And deep down, you're doing the same thing. You're unlocking an emotion and changing the organ's reaction. Your telomeres don't notice the phrase. What they notice is the result. Less cortisol, less inflammation, and more repair. Mario uses an image that I find beautiful. The flashlight of consciousness. Imagine that your mind is inside a dark room and you only have a flashlight. Whatever you shine the light on obviously becomes bigger. If you only pointed at your failures, at what you did wrong, at what others did to you, that's the part that grows. And what your nervous system does is interpret you know that everything is a threat, so inflammation, insomnia, and exhaustion. And your precious telomeres feel like they're under constant, relentless attack. But nevertheless, if you consciously decide to grab that powerful flashlight and deliberately point its illuminating beam in another, more positive direction, you absolutely won't be denying the fundamental reality of your situation. Instead, you'll simply be thoughtfully choosing which specific part of that vast reality is ultimately going to guide your intricate biology today. And this isn't some form of magical thinking or wishful fantasy. This is simply essential mental hygiene, a crucial practice for your well-being. For example, a painful memory comes up, a betrayal, a humiliation. Your flashlight almost instinctively goes there on its own. So you apply the 3-step mind surgery. First, you name what you feel. This hurt me and it hurt a lot. Second, you choose a different focus. And you say, what did I learn? What strength came out of that I didn't have then, but I do have now? And third, you ask yourself a question that will open things up. You say to yourself, well, okay, with the person I am now, what will my very next step be? In other words, you are moving the illuminating flashlight from your past experiences and bringing its focused beam into present action. The ancient Stoics, traditional Chinese medicine, Ayurveda, and the modern field of PNI all profoundly agree on this fundamental principle. What your mind truly interprets and perceives ultimately determines whether your physical body goes to war or into a state of repair. And here we return once again to telomeres, which are the heart of this series. Every time you choose an interpretation that lowers resentment, reduces anxiety, or gets you out of that toxic guilt, you're turning off that inner fire that wears down your telomeres long before their time. It's as if you were telling your DNA, relax, we're not at war, you can focus on repairing. At that moment, you will stop merely surviving or living poorly. Your mind truly is the most powerful pharmacy you have. And with this, we've reached the end of this series. Not just a single talk, but a whole system. Nothing you've heard in this series stands alone. Remember the complete map. In the first script, Longevity and Telomeres, we saw how your mental health, that is, how you manage stress, is a direct cause of how your cells age, of the length of your telomeres, and of how long and how well you are going to live. In the second script, the biography of values, I showed you that values like forgiveness, gratitude, and kindness are not just spiritual decorations. They are real biological antidotes that turn off chronic inflammation and protect your DNA from the slow-burning fire caused by resentment. In the third script, the critical voice and willpower, we saw that your inner dialogue is actually the conductor of the orchestra. It is truly the one that decides whether a significant setback becomes just a temporary bump in the long road that genuinely strengthens you, or a deep grave you never emerge from. And today, in this script, about Mario Alonso Puig, and with his company, you've seen the missing piece, the surgery of the mind. The conscious use of your attention, your language, and your actions as if they were a scalpel that cuts through the lies of fear and opens up space for your biology to heal. All of this is not theory, it's causality. Mental health leads you to telomeres, which in turn lead you to inflammation, which then leads you to immunity and ultimately to longevity. Every thought, every chosen value, every micro act of courage sends an instruction along that chain. And now, here comes the only thing that matters, your commitment. I'm not going to give you a list of 50 tasks because you wouldn't do it anyway. I'm just going to leave you with one question. But it's a question that, if you truly ask yourself, can help you change your life. What story are you going to choose to tell yourself about yourself today? The pervasive story that it's already irrevocably too late, that this is simply just how I am and there's no changing it, that my entire past definitively defines me, or the profoundly inspiring story of someone who, despite their inherent flaws, their past mistakes, and their visible scars, consciously decides to actively use their own mind as a powerful and unwavering ally, and certainly not as a destructive enemy. A compelling story in which stress doesn't dominate, but is just a signal, a helpful guide. In which resentment is not merely a punishment you inflict upon yourself, a self-imposed suffering that weighs heavily on your spirit, but rather a profound and oppressive burden you consciously choose to release and ultimately let go of, thereby granting your entire being, your mind, body and soul, a deep and lasting sense of tranquility and profound inner peace. In which guilt transforms from a punitive sentence into a profound lesson, an insightful mentor who guides you. Absorb the wisdom it imparts, rectify the errors within your control, and progress forward with renewed understanding and purpose. Your body is really listening to every single story. In your hormones, in your immune system, in your telomeres, you can't control everything. You also can control other people, and you can control your genetics. The genetics you inherited, that's what you have. But there is something no one else can do for you, and that you can control. Choosing the story you tell yourself when you look in the mirror, when you make mistakes, when life knocks you down, and it will knock you down. There, in that silence, that's where it begins. Your true medicine. Your operating room doesn't have cold lights or steel scalpels. It has thoughts, it has words, it has small gestures. And every day, on that invisible operating table, you have to decide, am I going to operate out of fear or with the desire to heal and to live? Am I going to keep writing a script that makes my biology sick, or am I going to start, sentence by sentence, writing one that heals it? You don't have to have everything figured out. You just have to choose the next thought that gives you a little more peace. The next action that is simply a little braver. Don't worry about the rest, because your biology will take care of it. Your mind already knows where you need to start. Your cells are waiting for the command. So please go ahead, always moving forward, and I will carefully read all of your comments.